for COVID-19 and a big panel of experts today. So please ask a good broad range of questions. Our experts include Dr. Bruce Aylward, Dr. Mariangela Simao, Dr. Sumia Swaminathan, who's joining remotely, and quite a few others. As usual, we're translating this simultaneously in the 6 official UN languages plus Portuguese and Hindi. Remember that under the Zoom system, you need to go to the Korean button to use Arabic. But now, without further delay, I'll hand over to Dr. Tedros. Dr. Tedros, you have the floor.
Thank you, Margaret. Good morning, good afternoon, and good evening. We're half a year on from the WHO sounding its highest alarm by declaring the COVID-19 outbreak a public health emergency of international concern. At the time, on 30 January, there were just 100 cases outside of China and no deaths. Since then, there has been an exponential rise in cases, and every country in the world has been impacted. And with major disruptions to essential health services, the ripple effects of this pandemic are having a major impact politically, economically, and in how people live their day-to-day lives. Everyone is asking, so how do we go back to normal? And today, I want to talk about not how we're going to go back, but how we're going to go forward. And that to move forward, the best bet is to do it together. In early January, at the beginning of the outbreak, WHO activated our global technical networks to gather all available information about this virus. Within the first 2 weeks of January, the viral genome of COVID-19 was mapped in China, shared globally, and the first PCR test protocol was shared on the WHO website. This enabled the first diagnostics to be developed, vaccine research to start, and soon after, millions of tests, PPE, and supplies were shipped around the world. In February, we held the WHO's Research and Development Blueprint meeting, where scientists and researchers from across the world came together to identify research priorities. A roadmap was created for the development and fair distribution of diagnostics, therapeutics, and vaccines. Also in February and March, numerous countries showed that it's never too late to suppress COVID-19 using a comprehensive approach. This includes active case finding and isolation, contact tracing and quarantine, adequate testing, and appropriate clinical care. With these tools, it was clearly possible to break the chains of transmission by a combination of traditional public health techniques. As the pandemic evolved, countries clearly needed to come together in an unprecedented way to develop new vaccines, diagnostics, and therapeutics, and to set the stage for ensuring that they reach all people everywhere. In April, WHO convened world leaders and launched the Access to COVID-19 Tools Act Accelerator. In just 3 months, the accelerator has already shown results. As of today, 9 vaccine candidates are already in the COVAX portfolio and going through phase 2 or 3 trials, and this portfolio, already the broadest in the world, is constantly expanding. And through the COVAX Global Vaccines Facility, countries that represent nearly 70% of the global population have signed up or expressed an interest to be part of the new initiative. On therapeutics, the first proven therapy for severe COVID-19, dexamethasone, was announced in June with support from the Therapeutic Accelerator arm and is currently in scale-up. On diagnostics, more than 50 tests are currently in evaluation, and new evidence has been generated around rapid antigen detection tests that could be game-changing. The ACT Accelerator is the only global framework for ensuring the fair and equitable allocation of COVID-19 tools, but it must be financed to be successful. IMF estimates the pandemic costs the global economy $375 billion a month and predicts a cumulative loss to the global economy over 2 years of over $12 trillion. The world has already spent trillions dealing with the short-term consequences of the pandemic. G20 countries alone have mobilized more than $10 trillion in fiscal stimulus to treat and mitigate the consequences of the pandemic. That's already more than 3.5 times as much as the world spent in the entire response to the global financial crisis. It's easy to think of the ACT Accelerator as a research and development effort, but in reality, it's the best economic stimulus the world can invest. Funding the ACT Accelerator will cost a tiny fraction in comparison to the alternative where economies retract further and require continued fiscal stimulus packages. Before spending another $10 trillion on the consequences of the next wave, we estimate that the world will need to spend at least $100 billion on new tools, especially any new vaccines that are developed. The first and most immediate need is $31.3 billion